then we will go over the medications within the respiratory system. A lot of them are the treatment for, of course, like asthma and COPD, and then we break down treatment for tuberculosis as well. So inhaled medications. So inhaled medications are either given via like a metered dose inhaler, a dry powder inhaler, or a nebulizer. So the most important thing to know, definitely know these 2 bullet points for the NCLEX. If 2 different inhaled medications are prescribed and one of them contain a glucocorticoid, you want to administer the bronchodilator first and then the glucocorticoid. On that same line, if 2 different inhaled medications are prescribed, you want to wait 5 minutes following administration of the first medication before inhaling the second. And then if a second dose of the same medication is needed, you wait 1 to 2 minutes before the second dose. So bronchodilators, there's 2 types of bronchodilators. You have sympathomimetic and then methylxanthine. So your sympathomimetic bronchodilators, an example of that is albuterol, and then theophylline is an example of a methylxanthine. So they're both used to treat acute and chronic asthma, bronchitis, any restrictive airway disease. So with albuterol and the sympathomimetic bronchodilators, they relax the smooth muscle of the bronchi, helping to dilate the airways of the lungs and making air exchange and respirations easier for the patient. Whereas the methylxanthine, such as your theophylline, they stimulate the central nervous system and they dilate the coronary and pulmonary vessels, causing diuresis and relaxing smooth muscle. So these medications like theophylline, they should be a last resort medication because they just have so many medication interactions. So they can increase the risk for digoxin toxicity and decrease the effectiveness of lithium and phenytoin. So with theophylline, you're going to monitor the lab values closely. A normal theophylline level is 10 to 20. Theophylline toxicity is likely to occur when that serum level becomes greater than 20. So definitely know your early signs of theophylline toxicity. The NCLEX may word it as, a patient is on theophylline. They're going to say they're experiencing this, and this. What are you going to do? And those may be signs of theophylline toxicity, and then, your priority nursing actions from there. So those early signs are restlessness, nervousness, any tremors, palpitations, and tachycardia. So recognize those as early signs of theophylline toxicity if that level is greater than 20. Bronchodilators, so side effects, they're going to make you kind of shaky, right? So palpitations, tachycardia, dysrhythmias, hyperglycemia, and restlessness. So bronchodilators are used in caution with patients with hypertension and diabetes because they can cause those dysrhythmias and that hyperglycemia. A patient taking bronchodilators, you want to educate them on the importance of avoiding caffeine or anything else that is going to cause tachycardia or palpitations. And then these medications, they're contraindicated. They can increase gastric acid production, so they're contraindicated in patients with peptic ulcer disease. They're contraindicated in patients with severe cardiac disease, any dysrhythmias, or uncontrolled seizures. Anticholinergics. Anticholinergics, an example is Atrovent. They're inhaled medications that improve lung function by blocking muscarinic receptors in the bronchi, which prevents bronchoconstriction. So they're used in the treatment for COPD and asthma. Side effects of an anticholinergic, of course, is dry mouth. So you could educate the patient on sucking on hard, sugarless candy that'll help with that dry mouth. Fun fact, and just something to know, just in case you see it in the future, a patient with a peanut allergy should not take Atrovent because the products that create Atrovent contain soy lecithin, which is the same plant family as peanuts. So just a fun fact. So leukotriene modifiers, they are, an example is Singulair. They're used in the treatment of chronic asthma. Very important. They are not used for acute asthma episodes. They're only used in the treatment of chronic asthma. They are a maintenance medication. Okay, so an example is Singulair. So they're contraindicated in breastfeeding mothers. You want to use in caution with impaired hepatic function. So a patient taking Singulair needs to have their liver enzymes monitored frequently. And it's important to take it 1 hour before or 2 hours after meals, and to take it with lots of fluid. So encourage increased fluid intake with the medication. Okay, inhaled nonsteroidal anti-allergy agent. So an example is cromolyn sodium. This is used for allergic rhinitis, bronchial asthma, and exercise-induced bronchospasm. It's used in caution with impaired hepatic or renal function. Some side effects are coughing, sneezing. It can sting the nasal passages or bronchospasm following inhalation, and you can also have an unpleasant taste in the mouth. Encourage the patient to take a few sips of water before and after inhalation to prevent the cough and that unpleasant taste in the mouth. Monoclonal antibodies. So monoclonal antibodies, an example is Xolair. So it's used to treat allergy-related asthma, and it's a sub-Q injection that the patient will receive every 2 to 4 weeks. So Xolair, it works on the allergic arm of the immune system, and it does slightly weaken the immune system. So these patients are slightly compromised. The dose is titrated based upon the serum IgE level and the patient's body weight. So different side effects include viral infection, GRI, sinusitis, headache. Because of the fact that the medication does slightly weaken the immune system, the patient should receive no live virus vaccines while they're on the Xolair. And then respiratory improvement, it's not immediate, but you'll see it in the future. It's just not immediate right after medication administration. Antihistamines. So antihistamines compete with histamine receptor sites, thus preventing a histamine response. So they result in a decrease in nasopharyngeal, GI, and bronchial secretions. So they dry you up. They result in a decrease in secretions. You want to use in caution with patients in COPD because of this drying effect of the medication. So use in caution with COPD. They can result in some drowsiness. So side effects are drowsiness, fatigue. They can cause urinary retention, constipation, or dry mouth. So it's very important to use in caution with patients with glaucoma because of the anticholinergic side effects of that. They could increase the intraocular pressure. Examples are Benadryl and Zyrtec. Nasal decongestion, so they shrink nasal mucosal membranes and therefore reduce fluid secretion. They're used in allergic rhinitis, hay fever, or acute coryza, in which there's just a lot of nasal discharge or drainage. You want to use in caution in patients with hypertension, cardiac disease, hyperthyroidism, or diabetes. Side effects include hypertension, high blood sugar, hyperglycemia, or nervousness. Nasal decongestants can also cause what's called rebound nasal congestion or rhinitis media mucosa. So it's important to not use them for any longer than 48 hours. Expectorants and mucolytics. So expectorants help to loosen the bronchial secretions. An example is guaifenesin, whereas mucolytics help to thin those secretions. An example is acetylcholine. So mucolytic agents, examples with mucolytic agents with dextromorphan, or it's found in like Delsym or Tussin cough syrup over the counter. They should not be used in patients with COPD because it will suppress the patient's cough. In a patient with COPD, it's important that they cough, that they're able to get up those excess secretions. So you want to avoid it in patients with COPD because you don't want to suppress that cough. Acetylcholine can increase airway resistance and should not be used in patients with asthma. So also acetylcholine can be used to prevent liver damage in a Tylenol overdose and also to help to protect the kidneys from contrast dye. So it has some other uses. However, its use as a mucolytic. You do not want to use it in patients with asthma because it can increase the airway resistance. Antitussives. So antitussive acts on the cough control center of the brain to suppress cough reflex. They're used for that irritating, non-productive cough, sometimes for that post-viral cough that kind of just lingers around for several weeks. Examples include codeine, Tessalon pearls, the dextromethorphan. You want to avoid administration of antitussives in a patient with a head injury or one taking opioids due to an increased risk for CNS depression. Opioid antagonists. So opioid antagonists reverse respiratory depression in an opioid overdose. The most common is Narcan. All right, guys, so tuberculosis medications. So the rest of the slides go into specifics on tuberculosis medications. Please certainly pause this video. These are just things that are going to take memorization for the NCLEX, but the NCLEX is likely to provide you with a medication. You need to be able to recognize it as a medication used to treat tuberculosis, and then it's going to ask for certain side effects, or the subject of the question is going to be about side effects or contraindications or things like that. So I'm going to go over the slides rather quickly, but I do want you to pause them and just try to absorb as much of that information as you can. So with tuberculosis medications, a multi-drug regimen is preferred. So active TB patients are treated for 6 to 9 months. HIV patients with TB may be treated a little longer just because they are so immunocompromised. As we talked about previously, there is multi-drug resistant strain of tuberculosis. So this occurs when a patient is receiving 2 medications, a first-line medication and a second-line medication, and then they discontinue one of the medications, leading to drug resistance. These medications the medication should be taken 1 hour before or 2 hours after meals. So a multi-drug treatment regimen, it destroys the organisms as quickly as possible. So active TB should always be treated with a combination of medications. Remember, after 2 to 3 weeks of treatment, the risk of transmission is greatly reduced, and then most patients will produce those negative sputum cultures within 3 months. So these are all of the medications. You have your first-line medications, which are the most effective, and then you have your second-line medications, which are used in combination with first-line medications, but they can be more toxic. And then this is where we break those down. So first, we're going to break down the first-line medications and then review some of the second-line medications. So isoniazid is one of the first-line medications. The main thing to remember, it can cause an increase in liver enzymes. So you're going to avoid use in acute liver disease or chronic liver disease. You want to monitor the LFTs, and then you're going to monitor for any signs and symptoms of peripheral neuropathy, because it can cause vitamin deficiencies, peripheral neuropathy, of course your hepatotoxicity and vision changes as well. Also, very important, you want to educate the patient on the importance of avoiding any tyramine-containing foods, such as aged cheeses or cured meats. The medication may cause red or itchy skin, a pounding heartbeat, and a headache. This is rifampin, so definitely pause the video and review this slide in depth. But the main thing that I want to get across with rifampin is that you can have those red or orange colored body secretions or increased uric acid levels. So if a patient is on rifampin, they report the red or orange colored body secretions, definitely communicate to them that that is a normal and expected finding. Then you have ethambutol. Again, side effects can include the optic neuritis, peripheral neuropathy, and increased uric acid levels. Contraindications, so you're not going to use it with optic neuritis or children younger than 13. Increased risk for neurotoxicity. All right, pyrazinamide, so using caution in patients with diabetes, may decrease the effects of allopurinol, colchicine, and probecenid for the treatment of gout. So it can increase LFTs and uric acid levels, can cause some photosensitivity. Rifabutin is used in the treatment of active MAC disease and tuberculosis in patients with HIV. So you want to avoid use with oral contraceptives. Again, the rifabutin can cause the red or orange body secretions as well as hepatitis. Rifapentine is used only for pulmonary tuberculosis. It can affect blood levels and oral contraceptives as well as warfarin. It can also cause the hepatotoxicity in the red-orange colored body secretions. Okay, capreomycin sulfate, there's an increased risk for nephrotoxicity, ototoxicity, neuromuscular blockade is increased, not given to patients receiving streptomycin. Again, these are pretty specific, but they just take a little bit of memorization essentially, just in case the NCLEX presents one of these medication options to you. So the use of antibiotics as a treatment for tuberculosis. So aminoglycoside or fluoroquinolone antibiotics are given with at least one other anti-tubercular medication. The most common side effect is going to be GI upset, along with some others here. And then they can impair the 8th cranial nerve, which is the ears. So you want to get a baseline audiometric test and repeat that every 1 to 2 months. Here's another one. It can cause metallic taste in the mouth, a little jaundice. So you want to monitor the liver enzymes. Here's another one. It can cause bitter taste. Educate the patient that the urine may turn red if it comes into contact with bleach. Another one, definitely pause and review over that. You have the streptomycin, which is an antibiotic. You're going to avoid its use with myasthenia gravis, Parkinson's, and then anybody with that 8th cranial nerve damage, because it can further damage that. So that's why you want to get the hearing testing done routinely. And then influenza medications. The different vaccines, you have the nasal spray, which is a live vaccine, which is not approved for pregnant women. And then you have the trivalent flu vaccine, which includes vaccine against influenza A and B strands. So that is it. Here's the reference. Always give credit to Saunders. Give credit where credit is due. I get all of my information from Saunders. But with the medications for the respiratory system, mainly all of those for TB, like I said, definitely be able to recognize it as a tuberculosis medication. The side effects that NCLEX is probably going to test you on is either going to be the change in the body fluid color or the hepatotoxicity and the need for monitoring of liver function enzymes. So definitely go back, like I said, pause the video, review those slides, and be able to recognize the names of the medication and then the associated side effects as well.